This is IAQ Radio, Indoor Air Quality Radio, the voice of the indoor air quality industry, with your hosts, Radio Joe Hughes and the Z-Man, Cliff Zlotnick. And now, Radio Joe Hughes.
Good day and welcome to IAQ Radio Plus. It's episode 745, and this week we welcome Dr. Elliott Horner and Dr. Nicholas Nassikas for a discussion about indoor air guidelines, policies, and regulations. This comes from their Paradigms and Perspectives articles in the Journal of Allergy and Clinical Immunology. Before we get started, let's thank our sponsors. They're the reason we can continue doing the show. IAQ Radio Association sponsors are AIHA, the American Industrial Hygiene Association at AIHA.org. IICRC, the Institute for Inspection, Cleaning, and Restoration Certification at IICRC.org. The Restoration Industry Association, RIA, at restorationindustry.org. The Environmental Information Association, EIA, at EIA-USA.org. Actionable Insights at getinsights.org. IAQ Radio industry sponsors are Particles Plus at particlesplus.com. BioPlanet at byoplanet.com. Tramex Meters at tramexmeters.com.
And now you can win a cool prize. It's time for the IAQ Radio Trivia question. Be the first to correctly answer. Simply email your answer to czlotnick at cs.com. Or if listening live, just text your answer from your computer. And now, here's the Z-Man.
Hello, everyone. Congratulations go out to Danny Goff, Energy Solutions, Inc. in Yadkinville, North Carolina, who was first to identify the number 3 as the maximum number of times Friday the 13th can occur in any year. Here's today's IAQ Radio Trivia question. In what year was the Clean Air Act established? Back to you, Joe.
All right. Today we welcome Dr. Nicholas Nassikas. He's an MD and attending physician in the Division of Pulmonary Critical Care and Sleep Medicine at the BIDMC and an assistant professor of medicine at the Harvard Medical School. His research focuses on how weather and air quality affect the respiratory health of children and adults. And Dr. Elliott Horner joins us again. He's the lead scientist at UL Solutions, has worked in the IAQ field for over 30 years, doing research and field investigations, doing training, disaster response, litigation support, and he was the director of an IAQ laboratory. He's a recognized expert on fungal allergens and the impact of moisture in buildings, and he has published over 50 research papers and book chapters. Welcome, gentlemen. Great to have you.
Thanks for having me.
Glad to be here, Joe.
My pleasure. All right, let's start. Dr. Nassikas, you're new to the show. Tell our audience a little bit about your background, if you would, and what got you interested in indoor air quality.
Yeah, so my background's in pulmonary and critical care medicine. So what that means is I study lung problems, lung diseases like asthma, and then also work in the intensive care unit. But a lot of my time is actually spent doing some research. And the research that I'm interested in is what are the different environmental exposures that predispose people, children, adults, to different lung diseases like asthma, or what are the things in our environment that cause our lung diseases to flare up? And so a lot of this work has been around air pollution, as you know, outdoor air pollution. And really, I would say there's been a pretty big shift recently to really studying the indoor environment. The science is pretty well established that bad outdoor air is bad for lung health. And really, we're starting to think a lot more about, well, folks spend most of their time indoors. That's where they're exposed to these things. That's probably an environment we need to start focusing on. So I was, fortunate to team up with Elliott for this article, and it was really fun to, think about some of these ideas, and obviously excited to talk to you all and hear more about your expertise in this area. So that's a bit about my journey.
All right. And Elliott, welcome back. Always great to have you. Dr. Horner, you last joined us, let me see if I got this right, in early 2024 with Tina Bruckner and Dawn Weeks, and we were talking about ASHRAE Guideline 42, 2023, Enhanced Indoor Air Quality in Commercial and Institutional Buildings. And I'm wondering, How has that been going? Have you seen much acceptance of people looking at doing enhanced IAQ in commercial and institutional buildings?
I don't, best gauge of that would be how many copies has ASHRAE sold, and I don't know what that is, that number is. But the intent of that document was to give people a information on how to go above and beyond the minimum. As you know, ASHRAE 62.1, the standard for indoor air quality, is a minimum standard. And the guideline 42 was information on how to go above and beyond the minimum. And it's it's out there. It's not a requirement. It's not written in enforceable language. It's information on how to do better than the minimum. And hopefully it's getting some traction out there.
I'm wondering, Dr. Nassikas, you're up in that Boston area. They seem to, kind of be a little ahead, I guess, of the curve on these kind of things. What do you see as far as implementation of more advanced IAQ guidance in buildings?
Yeah, it's a good question. I mean, I don't want to speak for the Boston community at large, but I'd say at least from the medical community, there's a lot more research in terms of the health effects related to indoor air quality. And I think kind of like you see with ambient outdoor air pollution, a lot of times some of these policies and guidelines are driven by the latest science behind the health effects. The health effects really can spur policy change. And so I think as more people are in the health field are paying attention to indoor air, we'll see better indoor air quality guidelines coming out. There's already been a lot that's been published, but I think the biggest issue right now is translating that to the medical community, and I think we're a little bit behind the curve on that.
I'm glad you said that. Now, I'm a member of the American Industrial Hygiene Association. This is kind of it's a follow-up basically. And there's been a lot of discussion in their chat room here lately about the response to COVID. Okay. And how there were problems with getting the industrial hygiene community feels they were shut out by the medical community when it comes to things like masks and respirators and so on and so forth. What are your thoughts on that?
Gosh, I obviously have not been privy to those same sort of conversations. I think a lot of the research that we do, we like to think about it as a multidisciplinary approach, right? But I think oftentimes partners get left out. And at least from my perspective, these are not, the partners that you're talking about, these associations that you're mentioning, are not ones that at least I have been intimately involved with. And so, if you're starting to think about different COVID policies, sometimes you have to just think about, oh, hey, what are the other organizations? What are the other associations out there that are thinking about this problem that we can team up with? And, unfortunately, I'm sure there were people that were kind of left out of those conversations. So, I think going forward, the greater the multidisciplinary, the base, the more impactful some of these policies and guidelines can be.
Dr.
If I
Horner,
could jump in for
go ahead.
one aspect to bear in mind for the COVID situation, there were a lot of people that had COVID and never had any symptoms. And the masking issue was, that aspect of the masking issue was a little outside of industrial hygiene bounds, I think, because industrial hygiene is usually focused on protecting the person that's wearing the mask. And a lot of the public health benefit of masking was in reducing what asymptomatic infected people were spreading. And it's what is coming out of the person, not masking to protect what's going in, but to reduce what's going out. And that is not, at least my time spent with AIHA type folks, that's not usually what they're concerned about. They were concerned about protecting the wearer, not the public at large. So that was, during COVID, I was involved in a couple of email conversations with industrial hygienists, and that seemed to be getting left out of their thinking. But go ahead.
That's an interesting perspective.
Yeah,
I think also people forget we were in an emergency situation. It wasn't like the medical community had time to make the connections they hadn't already made, Dr. Nassikas. They just didn't have time. I mean, it was like, we're going to make these decisions and we're the right people to make them. I think now, hopefully, and maybe you could tell me, are there more bridges that have been made between these communities now?
Yeah, that's a good question. Because COVID is not necessarily the major focus of my research, I don't know how many bridges have been built. But what I can definitely speak to is when this was all happening, kind of like you mentioned, it was a full-on crisis. And as someone who was in the intensive care units during this time, I can just tell you the only thing that we were thinking about is how to try to keep these people alive and then how to protect ourselves. And it was a challenge. There was just a lot of we were learning new things every single day. And I think now that we have some hindsight, we can start to say, hey, what could we have done better? What are the bridges that we could have built? And then this might not be the last one. What do we do going forward if this comes up again? How do we, reach out to these folks and make sure we have the infrastructure in place to deal with this in a better way?
Hopefully we'll have time during the roundup, because I'd like to also ask you both what you think about this H1N5 that's now circulating in the bird. I think that's the correct numbering for the bird flu. But let me jump before we go too far down any side paths here. Let me get back to where we were going before. Dr. Nassikas, we here have been following mold and dampness related issues. We've been doing this show for almost, I think it's 18 years now, which is before people even knew what podcasts were. We were doing this. And Cliff and I have both been in the indoor air quality disaster restoration industry for 30, 35, 40 years. And during that time, we've been involved. I've noticed that it's been tough. There's a statement in the paper that says mold and fungal growth result from dampness and are triggers of asthma symptoms and exacerbation. And I remember when that wasn't widely accepted in the medical community. I remember doing courses with people from departments of public health that argued about that. Is that now widely accepted?
Yeah, I'd say that's widely accepted at this point. There's general consensus that mold, dampness can be both a trigger and probably a cause of asthma. And I think throughout our conversation today, I'll probably be mentioning kind of two separate things about asthma. One is the development of the disease, and then the other is the exacerbation or the flare-up of the disease. So there's some things that can cause asthma. There's some things that can trigger your asthma, and then there's some things that do both. And so I think in the case of mold, dampness, fungal growth, there's a general consensus that these things can trigger asthma exacerbations. There's been some pretty good science that's shown that exposure to these things, especially in people that are allergic to fungal specimens or mold, those people can be at risk for having lower lung function. That's, their breathing tests are actually lower. They're at increased risk of getting hospitalized, even potentially increased risk of dying from asthma. And then I think there's also some pretty good science that's shown that, especially early in infancy, if you're exposed to, fungal growth, mold, it can predispose you to developing asthma. So kind of two things: it can trigger the asthma and also potentially even cause the asthma. So I think we've come a long way, probably since when you started the show, and there's general consensus around this. In fact, just back in 2011, so that was quite a while ago, there was a great paper out of Environmental Health Perspectives that talked about this connection and seemed to really be coming around the consensus that these things were related.
Cliff, you have a follow-up?
Yeah, I did, but I think I think he touched upon it, and I think work that Dr. Jay Portney did with children and so on and so forth, and people just I think that's probably what really brought it really to my attention and made me think about it, because I had a son who had pediatric asthma and so on and so forth, because we experienced it with him, and the trips to the ER and the inhalers and all that other stuff. But I think that's right. This pediatric asthma, I think is maybe, if you could comment, whether you think that kind of brought it into the limelight or not.
Yeah, probably. I mean, a lot of the work, especially when you start talking about development of asthma, we really focus, a lot of the research is focused on kids who develop asthma. And then, you not only try to figure out why they're developing asthma, but then what are the time periods that they're most sensitive to getting exposed to these things, then later on developing asthma. It looks like, that infancy period, getting exposed to mold and fungal growth is really the greatest risk of later on developing the asthma. But then it's also true that adults can be exposed to these things and it can trigger their asthma. I certainly see patients in my clinic who, I had a guy who was, what his job was doing HVAC work. He was in these moldy basements all the time, and he had terrible breathing problems. And, finally, it's hard to modify your job except quitting. And so he finally said, I'm ready to retire. And his breathing was much better after that. So it's certainly true that, these exposures affect adults as well as kids.
We've got an audience member that is, he has quite a bit of issues with indoor air quality, and then he has problems with his breathing and so on. Does that also, his concern is that also is affecting his organs because they're not functioning as well as they could have been? Does that make sense?
Yeah, one of the things I like to think about is, the body's is an interconnected system. And so if one organ isn't working, it can certainly affect the other organs. I think one of the reassuring things about asthma, and that's one of the reasons I like studying it, is that there's good ways of treating it. And a lot of that comes down to avoiding the triggers. And like I said, that's easier said than done. If you live in a polluted area right by a major roadway, we're saying you need to move to a different home or at a minimum install, air purifiers. Or if you're in a job where you're exposed to these things, that can be a challenge. So trigger avoidance is one of the things we talk about a lot, but with the understanding that can be kind of hard. And then the other thing is there's there's medications for treating the asthma. So I think, if the breathing is really a problem related to the home environment, trying to identify the things that you can clean up. And then if those things you can't get rid of, then at least trying to control the asthma, and that can help prevent things that might affect the other organs. And certainly being sick from asthma all the time, after many years, that can take a toll on the rest of your body. So it's definitely a disease that, if it's not controlled, can wreak havoc. But fortunately, we're at a place where we have a lot more therapies for it.
I think his contention is too that he's in a catch-22 because the medicines you mentioned may also cause problems for him.
Yeah, that's the one that everyone thinks of with that is, we have these things called steroids. They're basically these really powerful anti-inflammatory agents. And if you are so sick all the time that you need a lot of this steroid, then it can wreak havoc on other organs. But the goal is always to get the asthma under control so that you don't need all these major anti-inflammatory medications. And I think there's been some really cool advances in medicine, especially in the field of asthma, where we have newer medications that can really help people get into a better controlled space with their asthma.
Well, and that kind of leads to the discussion of indoor air quality guidelines, policies, and regulations, because he's a big advocate for making sure that we have some kind of guidelines, policies, or recommendations that when you walk into a building, there should be, flashing lights that tell you, hey, you've got too much CO2 or too much this or too much that, which leads me to a question for both of you. Another statement in the paper is that exposure to VOCs, volatile organic compounds, are associated with an increased risk of childhood asthma, respiratory symptoms, missed school days, and cancers. I guess my question is this now seen as consensus in the medical community, particularly that VOCs are associated with increased risk of childhood asthma?
Yeah, what I would say with VOCs is, there's been a number of pretty good systematic reviews, which basically are papers that take all the known literature out there, try to compile it into some sort of consensus, that have said that VOCs certainly pose a cancer risk. And I'm going to talk about VOCs kind of generally. There's also some evidence that VOCs can trigger asthma symptoms and potentially even heighten your risk of developing asthma. What I would say is the science there is not as strong as it is for the mold and fungal growth, like I was mentioning. But I would say that's another area that is being actively investigated. There was another good systematic review that came out from a journal out of Europe that basically said that the evidence is pretty weak for VOCs and asthma exacerbation. But one of the things they left out was phthalates, which probably are the ones that maybe cause the greatest risk of having an asthma exacerbation. So I would say the evidence is not as good as it is for mold and fungal growth, but certainly there's something there. And I was part of a workshop that was put on by the Annals of the American Thoracic Society. And what we did in that was looked at a few different indoor sources of outdoor air pollution, and one of them was VOCs. We kind of spent a lot of time trying to talk about, is it volatile organic compounds, volatile consumer products? But at the end of the day, where we landed was that this is an area that needs more research. We can't come down. There's not the same level of evidence to say that VOCs cause asthma exacerbations or VOCs cause development of asthma.
Elliott, let me get you to follow up on that, if you would. It's a general statement related to VOCs in general, and you do research, and you're at UL and so forth. I'll bet this was tough to write because you got the difference between VOCs in general and specific VOCs. Could you comment on that?
That's a key point, Joe. Many of the research papers or many of the investigators in the field will look for just an aggregate total VOC or measure just a couple of VOCs without necessarily identifying all of the VOCs that are in the exposure situation. And that can be very important. All VOCs are not alike, as you've been around industrial hygienists long enough to know that. And there are also different methods of sampling and different methods for analyzing for VOCs in air. And if you use a different method than somebody else, you probably will not get exactly the same results. Hence, the VOC measurements in the literature are not all really directly comparable. As a matter of fact, probably relatively few of them are. And that makes it much more difficult for people doing a review article or trying to synthesize what all is going on, as in the workshop Nick was talking about, how to tease out the useful bit of information. Some VOCs are probably very potent, and others are probably benign. So that's a challenge of dealing with the VOC literature, is how were they measured, how were they analyzed, and were they identified or just looked at in aggregate?
And I wonder if you could follow up on his mention of phthalates and the problem with them. If I recall, I thought they were considered a semi-VOC, SVOC, but maybe I'm wrong. Maybe they're an actual VOC. And I don't know that the difference is really all that important, but Elliott,
yeah, don't be careful about how finely you want to draw that line. This is more of a continuum, but I think the phthalates generally are heavier, lower vapor pressure or lower boiling point compounds, and so they are exposed. At least in my discussions with the ASTM committees looking at analytical methods for phthalates, they generally are looking at a lot of stuff that is particle bound. And so there again, the analytical procedures are not as well developed. So hence the exposure assessments have greater uncertainty associated with them.
Interesting. Very interesting. Paula, I will get to this in a second. It's great to see you, by the way. Let me mention also the Indoor Air Quality Guide, which was this is a quote from the paper. The Indoor Air Quality Guide, which was released in 2010 by multiple professional groups and EPA, presents best practices for design, construction, and operation of buildings to improve IAQ. I have a copy of it here. It was updated by ASHRAE 42 in 2023 and was entitled Indoor Air Quality in Commercial and Institutional Buildings. And I think we actually chatted about that a moment ago. I just wanted to make sure that we emphasize that this document's out there, it's available. And Elliott, I didn't even realize how big it is. Can you maybe give folks a little better idea of what we've got here?
The book you've got in your hand it came out in 2010. What you're holding there is about 150 pages, 120 pages, which is a summary of the full 1,400 page document, which should be available on a CD on the back cover of that document. ASHRAE, I believe, made it available free of charge at one point. I'm not certain it still is, but it's available, certainly should be available on the web. And the guideline 42, ASHRAE, I'm sure will require you to buy that one, but it was basically put together to pull together information that has come out since 2010 when that document was published.
Oh, okay.
But
Okay. So
both of those documents are designed for people to go to have good indoor air quality and to go above and beyond the minimum standards such as 62.1, ASHRAE 62.1, and ASHRAE 62.2.
there's a great comment I want to make sure I bring up here. Mold growth and moldy smells indicate conditions that support all kinds of biological contaminants, which is a very important, I think, distinction there. Dust mites, cockroaches, other biological proteins. The patient may react to the environment even if allergy to fungus isn't established. I just want to point that statement out, and I see you shaking your head, Dr. Nassikas. Do you want to follow up on that?
Yeah, I definitely. I think a lot of the things that I mentioned are kind of, taking if I say mold and fungal growth, it's pretty broad. And you're absolutely right that, people can react to these things despite, not being sensitized. And when I say sensitized, there's different tests that we can run to see if someone has maybe a predisposition to developing an allergic reaction to, certain types of mold. But we know that even people that aren't sensitized to mold or fungal growth still could have their asthma triggered by it. So I think you're absolutely right that just having an allergy to the mold doesn't mean that you're free and clear.
Excellent. And Elliott, did you want to follow up on that?
Yes. When I started working with fungal allergens back in the late 1980s, they were regarded by the allergy community, fungal allergens were regarded as by the allergy community as being pretty non-significant, harking back to a comment that was made earlier. What they didn't realize, what was not widely recognized, was the poor quality of allergen extracts that were used for testing and for immunotherapy, and the degree of cross-reactivity among fungal allergens, which is tremendous compared to other allergens such as dust mites or cats or cockroaches. Fungal allergens are cross-reactive, and there also don't seem to be the major allergens that occur in some of these other sources, such as dust mite, cat, cockroach, etc., where there's one or two proteins or glycoproteins that almost all people that are allergic to that source will react to that one compound. Fungal allergens are not that differ in that regard. There doesn't tend to be a major allergen for a lot of the fungi. There are some, Altae-1 would be a good case, but many of the fungi don't have major allergens, and there is a tremendous cross-reactivity. So which means you may be sensitized originally to one fungus, but then your body could also react to a completely different fungus because of these cross-reactive allergens. One other point is it's not been, at least it was not widely recognized in the allergy community when I started working with fungal allergens, that there are lots of non-IgE mediated factors that fungi produce that can also elicit reactions. IgE allergens may actually be a minor factor in how the human body reacts to fungi. That's better appreciated now. The glucans, in particular, also Tina Raponen's group has shown that moldy surfaces, mold colonized building materials are tremendous sources of PM 2.5, which we know from outdoor work is an important factor in people's respiratory health. So there are things other than allergens that fungi produce that's better appreciated now than it was 30 years ago. And probably helps explain some of the difficulties in tying exposure to mold and moldy environments to respiratory health.
Interesting. I know there's been a lot of talk about the glucans here recently, and I know it was a big topic in the AIH or the ACGIH bioaerosols book that came out. We had Dr. Miller on to talk about that. Very interesting. I'm glad you brought that up. Let's stop here for a minute. We've got to thank our sponsors for halftime. We'll be back for the second half of our show with Dr. Elliott Horner and Dr. Nicholas Nassikas. Our association sponsors are AIHA, Healthy Workplaces, A Healthier World, AIHA.org. The Environmental Information Association, EIA's multidisciplinary membership collects, generates, and disseminates information concerning environmental and occupational health hazards in the built environment at EIA-USA.org. The IICRC, a nonprofit standards development and certifying body for the cleaning and restoration industry, IICRC.org. The Restoration Industry Association, the oldest and largest nonprofit professional trade association dedicated to providing leadership and promoting best practices through advocacy, standards, and professional qualifications for the restoration industry at restorationindustry.org. Actionable insights, no more mistakes, no more missed line items in your Xactimate estimates at getinsights.org. Industry sponsors are Particles Plus, feature-rich particle counters and air quality instrumentation. Count on us, particlesplus.com. BioPlanet at byoplanet.com, improving human, animal, and environmental health with electrostatic spray technology and advanced chemistries at byoplanet.com. Tramex Meters, innovation in moisture detection and humidity monitoring systems since 1974 at tramexmeters.com. All right, we're back with the second half of our interview with Dr. Nassikas, Dr. Horner. Cliff, before I jump into this next section, did you have any follow-ups or questions you wanted to ask?
No, I'm good, Joe. Thanks.
All right. Let me ask, I found this fascinating when I read the paper that it mentioned that EPA has also published a booklet titled Indoor Air Pollution: An Introduction for Health Professionals. It describes clinical presentation, diagnostic tests, and remediation strategies for indoor air pollutants, including VOCs, aeroallergens, and heavy metals. I was real happy to see it mentioned because I always included that document in the indoor environmentalist courses we did over the years, but I wanted to make sure it's the same document. This was a very old document. Dr. Nassikas, am I correct in saying this was like in the 90s?
Yeah, I'm pretty sure it was published back in the 1990s, but I think it's still an important document, and I think it's one of those documents that still holds true to today. I mean, if you look through it, there's nothing in there where you'd say, gosh, science has really shown that these things tend to be less bad than we thought they were. If anything, it's the evidence has only shown that these things are as bad as we thought they were, if not worse. And so I think as a document, it really it still holds water. And I think the EPA, this document that they put out, as well as some other one-pagers that they've published more recently, are kind of an introduction to this concept. And I think that one in particular is quite relevant for clinicians who are saying, okay, what's the problem? How do I diagnose it? And then if I find it, what do I do about it? And so I think it's still one of those relevant documents to today.
Yeah, and I thought it was important for the people going out and investigating buildings to know what the medical community is being taught. I mean, how widespread, how familiar is the medical community with that document?
So that's a really good question. I'm not sure, but I would guess that that there are few medical professionals that have actually seen it. And I think this is maybe where we have a lot of work to do. That as the science grows in looking at different exposures in the indoor environment, the translation of that science to the medical community certainly needs to improve. And I think there's increasing interest, but it's certainly not at the same it's certainly not at the same stage that ambient outdoor air pollution is, right? And even when I give talks on outdoor air pollution, I still have people, clinicians asking questions that to me sometimes seem obvious about outdoor pollution. So we still have work in that field. You can imagine that for indoor air quality, there's still a lot of work to do. And we're making progress, but still behind.
You kind of hit on a question that came in through the text. Who is educating people about indoor air quality and its impact on health? How is good information distributed in plain English to general people? And either one of you, I'll throw that out for either one of you.
Yeah, I guess starting at the medical community, who's translating this stuff? It's in medical school, it's lectures. And so you need a lecturer who's familiar with these, with this topic. I teach a course on environmental lung disease at the Harvard Medical School and also one down at the Brown Medical School. And it's something that, I try to incorporate. But how many times they're being exposed to this during their medical school training, it's hard to know. And then I think a lot of this comes down to also publishing pieces in journals that are widely read. And so I think, that's why it's so great to team up with Dr. Horner for this. And JACI is a high impact, well-regarded medical journal that gets a really wide audience. And so, to have an article in there means that people, well, one of the things I'll first say is that JACI decided to put out a special issue on indoor air. That tells you something about the interest level, that they wanted to devote an entire issue to indoor air quality. And so there's a lot of great pieces in there, but I think that's one way to disseminate this information to a wider audience.
They also did one that was strictly on mold, if I recall correctly, a few years back. Actually, I think we did a show on that with Dr. Portnoy. But Elliott, I wanted to ask, is there anything you wanted to add on that?
In terms of getting information on indoor air quality out to the general public,
yes, sir.
Probably most of the knowledge transfer is done through the internet. And we all know that everything on the internet's absolutely accurate. To the degree that it's accurate information that's getting out to the public. But I'm sure you can, look on the internet and get all sorts of information about indoor air. But in terms of otherwise, the conventional press, newspapers and such, they're still using that, what I consider a pretty misleading headline, black toxic mold, is everything that you see. Frequently, if I see anything in a magazine or newspaper about indoor air quality and moisture issues, it's got that headline tagged onto it, which is very misleading in my opinion.
And it's not just there, it's also in industry publications. I see it all the time and it drives me crazy. You would think they'd know better, but I guess somebody's advertising and they have to, have to pay the bills, I guess. But it's a tough situation. I also have I want to mention to Kurt Johnson up at the Maine Indoor Air Quality Council. Kurt, please put the link up now, and we'll get it in the draft in the blog, and we'll try and get some comments in. They are working with the legislature to submit a bill to try and address some of these dampness and mold issues in rental properties, which again is the whole idea behind this show. The idea is to try and get some more federal guidelines and standards and regulations, not just federal, state, actually local and state are much more likely now, I would think, than anything on the federal level at this point. But very interesting. All right. Now,
Joe, while you're talking about the states, you might as well mention the Hopkins Model Clean Indoor Air Act.
Why don't you go ahead and talk to us about that just a minute?
It's most of the people listening probably are aware, but the group at Johns Hopkins drafted a model state Clean Indoor Air Act, I believe is the title of it. But it's written for states to adopt into their building codes or other laws or regulations in part or in whole. So pieces and parts of it could be taken out and adopted and passed by a state legislature to try and get more action on improving indoor air quality. And that's something that I'm sure you've already got it in your blog, and I think you guys did a podcast on it several months ago. But that's something that is certainly worth looking into. The work's been done on writing it. All you got to do is get it in front of a legislature and get them to approve it. The legislature doesn't actually have to sit down and put pen to paper and write the thing. It can be adopted as is in part or in whole.
We did do a show on that when it first came out. I want to say that was early 24 or maybe even early 23. I remember Gigi Granville and I can't remember the other name, and I forgot to put it in my notes, but we will definitely put the link to that show up in Cliff's blog. Cliff, if you can make a note on
Yeah,
that
I
one.
did.
All right. Now, another thing that I noticed in the paper was it said counseling patients on interventions such as switching from combustion to electric appliances, improving building ventilation, transitioning away from scented products. That can help reduce their exposure. Air cleaners with high efficiency particulars have been shown to reduce exposure as well. And they also mentioned that for physicians and patients engaging with organizations and professional societies at all levels by writing letters, providing testimony, advocating for policies. Can you give us some examples where this has been helpful? And actually, I could give one right now. MIAQC is currently working with the legislature to submit a bill and try and address some of these dampness and mold issues. But I wonder if you could give us some idea of where some concrete examples of where this has been helpful.
Yeah, so I think, to answer the first part of your question on interventions, I think, that's where a lot of the science I think, needs to go. That we know a lot of these things in our air, outdoor air, indoor air, may be harmful. And then the question is always, well, what do you do about it? And I think that's an area of a lot of growth right now. One of the things that has garnered a lot of attention, especially since COVID, are these HEPA air purifiers. And there's been some research that's shown these HEPA, purifiers can reduce concentrations of indoor air pollution, air allergens. If it's attached to a carbon filter, it can help filter out nitrogen dioxide. But then linking those decreases in concentrations to improvements in health, that's a different jump. And I think for that piece, there's also been some pretty good studies that have come out showing that some of these HEPA purifiers can, in kids with asthma, can help improve their asthma symptoms, improve their breathing test, their lung function test. But it's still not the strongest evidence. So we have a lot of work to do there. I'm currently involved with a randomized control trial run out of the Harvard School of Public Health and Beth Israel, led by Mary Rice, on looking at whether or not these indoor HEPA air purifiers can help people with COPD, help their breathing symptoms, their lung function tests. And so it's an area of active research. But really, we need to start focusing on, okay, if these things are bad, what do we then do about it? What are the interventions? And then I think to your second point, concrete examples. So this is where it's always tough. In the paper that Dr. Elliott, Dr. Rice, and I put together in JACI that we've been talking about, we mentioned some of the ways that it was focused on allergists and immunologists, but ways that clinicians and patients can get involved with this. And we mentioned getting involved with professional societies, writing, providing testimony. These things matter, but it's harder to say that was the thing that changed policy. I think one concrete example that I can think of recently, and Dr. Horner probably can add more, is, if you think about the recent change in the annual PM 2.5 standard, they lowered it from 12 to 9. That was based on just a groundswell of health science that showed that there's really no lower threshold for PM 2.5 causing adverse health effects. And so it was the kind of impetus for that change. And so as the science gets better, the policy can get better. And is it one specific amicus brief or one specific public testimony that does the trick? No, but it's probably the collective voices, the collective community coming together and saying, gosh, this really is a problem. The evidence shows that any level of PM 2.5 is bad for health, so we really need to lower these standards. I don't know, Dr. Horner, do you have any?
Well, I agree with what you're saying. Thanks for pointing that out. A concrete example that I can offer is testifying before a committee of the Atlanta City Council when a smoking ban was being voted on. And Atlanta was one of the last major cities in the country. I'm sure there's still some out there that don't have any smoking ban, but Atlanta was one of the last major cities to enact a smoking ban. And just concrete example was it was a HVAC engineer who took time out from her schedule to go and testify, make a 5-minute statement in front of this committee, which was, I think, persuasive to some degree in gaining support for that measure. Very concrete, very specific, and also a real tiny piece of what needs to be done. And it would be great to have these laws put into effect at the state level. We'll take them at the city level, but getting the word out there to people who are not specialists, but who are in the positions of making decisions about policy is a very important way of going about this. But it's tiny steps at a time. If you're taking one committee of one city council at a time, and you're getting professionals taking time out from their schedule, those are not billable hours when you're testifying in front of a city council committee. But that's part of what needs to be done at the other end of the spectrum from the Fed's EPA reducing PM 2.5 levels from 12 to 9.
And I also was interested in that statement. It said that counseling patients on interventions such as switching from combustion to electric appliances. And I noticed that nitrogen dioxide, NO2, was mentioned in the paper. I'm wondering how widely recognized is that in the medical community, Dr. Nassikas? People, they're exposed all day, every day. And in some cases, pretty decent levels.
Yeah, I would say that at least, for nitrogen dioxide, the science is pretty clear. There's pretty good evidence that, exposures to nitrogen dioxide are associated with asthma flare-ups. So those are asthma exacerbations, and then even development of asthma. So I think, at least the science there is pretty strong. And so, when you start thinking about, okay, if the science says this is bad, then what do you do about it? Some of the low-hanging fruit are switching out any combustion-related appliances for electric compliances. And so the gas stove tops are one thing that we mentioned.
All right, let's go to the roundup, and then I found my notes finally. I was very confused there for a minute. I know I put questions in here on a couple things, but I will get to those in the roundup. Grayson? All right, the roundup is brought to us today by Tramex Meters, tramexmeters.com. I just want to mention Johns Hopkins Center for Health Security published that Model State IAQ Act. And that was in 2023, as I mentioned, and we'll put the link up for that. And actually, we did a great show. Cliff already put the link in here. What do you guys think about the approach they took, going after it kind of on a state-by-state level?
Do you want to take this one, Dr. Horner?
Okay. I have no idea what their thinking was because I was not involved in developing it, but I think it is certainly far more practical from the standpoint of getting something done. You're more likely to get something done at the state level than at the federal level. And as I mentioned before, with the example of the Atlanta City Council and a smoking ban, you'd like to have more. You'd like to do it, not do it city by city or county by county. You'd like a bigger chunk at a time. So from that standpoint, I think they targeted the appropriate level of government and policy making, decision making, et cetera. I think they also were very smart in drafting the document so that it did not have to be adopted in total. It could be adopted in parts. So I've got some very good work included in that document, and hopefully there'll be some states starting to take a look at it. I don't know. I'm not familiar with any states that are actively doing it now. You mentioned the Maine IAQ group. They may be working on something along the same lines. I don't know if they're using that document or not, but targeting it at the state level and getting whatever can be passed, pieces and parts, I think is certainly a smart way to go.
Cliff, I want to make sure you have a chance to jump in here.
Yeah, I just, from my vantage point, it just looks like the federal government is just focused on climate change, and that's the big thing, and energy conservation. And I don't understand why they're not focused on this. And, What do you think their reasoning is for not focusing on it?
Yeah, I guess from my perspective, all these things are important. You got to focus on all of them, and but there's limited resources, and so where do you devote the most amount of your energy? And I think that's a tougher question, and I'm not sure. And part of this could be that if you're the federal government, you're kind of speaking to what are the issues that seem to be the most pressing. Well, climate change is certainly one of them, but indoor air quality, I think this is where the translation of some of the science to the lay public or to the medical community can start to drive more interest, and at the city, state, and the federal level. But I'm so biased, right? I'm a researcher, so I'm biased to think that research can help shift the focus. So. But I do think there's something to be said for that. If we start to understand the harms of indoor air, it'll be easier to advocate for more attention to the topic.
And to
Dr.
some
Horner,
degree,
anything?
it's going to have to come from the voters. Elected officials respond to voters, and when the general public starts saying, "Yeah, climate change is important, but I'm also interested in the climate in the house that I live in." Residential will be more difficult, but office buildings, schools, commercial real estate, etc. Those are areas that could be where policy could be enforced from a legislative standpoint, and that would set an example when people begin to see that their schools, their office buildings, etc., have these rules put in place in order to attain a certain level of air cleanliness. They say, "Well, why wouldn't I want the same thing in my home?" But getting government to tell people what to do in their house is going to be very difficult. I don't think that's a good use of anybody's resources. But we can do public spaces, either at the state, local, or federal level, and get the industry behind being proactive on indoor air pollution, indoor air quality, and let it filter down from there when the general public sees that it's possible and there is a benefit.
We had a comment after discussion of the NO2. There are several studies that show that people don't start exhaust fans in the kitchen while cooking, and that could certainly help. This is where education, we've got to educate people. And first, I guess we have to educate the clinicians too. And it seems to me that would be a great way to start, get them to start using those exhaust fans.
Yeah, there's actually some really good studies out there, like Kishore mentioned, that have looked at this, and people don't turn on their range hoods, and I think it's a really good point to raise, because it's we talk about the gas stoves, but it turns out electric stoves also really have release ultrafine particles, PM 2.5, when you turn them on, and so the range hood plays a role no matter what you're cooking on, gas stove or electric cooktop. And so, I think that is a great place to start, saying, hey, if you have a range hood when you're cooking, turn it on.
You might caveat that just a little bit and ask, does that range hood exhaust to the exterior of the building, or just pump the air right back into the kitchen? There's discussion, I know, in ASHRAE 62.2, the indoor air quality standard for residential, proposals have been made to require range hoods to exhaust to the outside of the building. I don't think it's been passed. I think it's very contentious. The builders don't want to deal with it, but that would be a simple step that would be a tremendous benefit to people's homes, the indoor air quality in people's homes. If new construction, new or big major renovations were required to install range hoods that exhaust to the exterior of the building, be a big step forward in residential indoor air quality.
I think it would also be very helpful if we were able to get quieter range hoods that weren't outrageously expensive. And I don't know if either one of Dr. Horner, have you studied any of that?
I have not. I know there are people looking at it, but I've not been involved in any of those studies.
Because I got a nice range hood out there, but man, you can't even hear the TV when the thing's on, and that causes problems in a family. Anyway, I also want to mention that one of our audience here was listening to, or was at the doctor. They were talking about their house, and that the medical community is focused on helping sick people, not necessarily on prevention. Dr. Nassikas, could you comment on that?
Yeah, this is the challenge. I mean, the old saying is prevention is better than cure, and I firmly believe in that. But it's challenging, right? Clinicians, healthcare providers only have so much time with their patients who are coming in with problems. It's really hard to spend the time that's needed to talk about nutrition, to talk about sleep, to talk about their home environment, things that can help improve their health, prevent disease in the future. A lot of times we spend the time talking about, okay, what's your disease? How do we get you better? Here are the medications you can use. There's you all, I'm sure, have seen the articles in all the papers here, about the kind of the burden that these primary care doctors have. They're dealing with so much that it's a real challenge. So it's a great point. Prevention is better than cure, but remains to be a big challenge.
And
we have the
the
patients need to
prevention
be
part of it,
focused.
a lot of that's going to fall on architects and engineers. By the time it gets in Western medicine, by the time a patient gets to a clinician, the harm is already done. If you want to prevent it, you don't talk to an MD, you talk to an architect or an engineer or a contractor, because a lot of the preventive measures are how the building is designed, built, and operated.
Cliff, you had another really good question you submitted. I want to make sure you get a chance to ask it.
Okay, well, yeah, that question was, Elliott, you had mentioned in the article and speaking with us that you were dismayed by lack of government regulatory progress on IAQ. And I think that over the time that Joe and I've been around, you've been around, it has increased. In the 1970s and 80s, I didn't really hear much about it or think much about it, and it seemed in the 90s it increased, and turn of the century, I think it's increased. Don't you think it's getting better?
Getting better in terms of public awareness of indoor air quality or legislative action?
No, public awareness.
Public awareness has certainly increased, yes.
Right.
Yes.
Okay. Well, and I think, as you said, with voting and so on and so forth, that should drive the legislation, I hope.
Well, one would hope, yes.
Another statement in the paper that I find fascinating, and it kind of ties back to this, how long it takes to get things done. As of 2023, 28 states, home to 61% of the U.S. population, had a total ban on indoor smoking in public buildings. Another 10 had partial bans, and 12 had no indoor air bans or no indoor smoking ban. That's been going on for how many years now? And it's still, we got, 12 states that don't ban indoor smoking.
Yeah, so this is kind of a central piece of the article that Dr. Horner, Dr. Rice, and I put together, is that you have all these different policies, guidelines. They vary by state, city. They have different teeth in terms of enforcement. And I like we like the tobacco example, because even if you have all this patchwork of policies and guidelines, you can still affect real change. And I think I'm kind of giving you the half glass full, interpretation of this. But I think even with tobacco, the fact that it varies so much, we've still seen reductions in death from tobacco smoke. So there's progress to be made, even if it's incremental, even if it's patchwork. And I think having that same sort of optimism for indoor air quality, might be helpful.
All right. Before we go, we always like to give you the last word. Dr. Horner, let's start with you. Any final thoughts? Anything we missed?
I would call out the Environmental Law Institute. They've got they keep a listing of all the rules and regulations that are out there. We cited a couple of them in the paper as an example of just how specific and narrow a lot of these rules are. There are plenty of rules. There are rules and regulations out there, but the one from one of the states had a law that said public schools should look towards getting rid of mercury devices in their science labs. Great. That's wonderful. How in the world would you enforce that? But I mean, I would encourage your listeners to take a look at the Environmental Law Institute and see some of their listings of what is on the books out there. That's a pretty useful source of information.
Great point. And Dr. Nassikas, same question for you. Anything you'd like to add?
I guess I liked my half glass full interpretation. I would just add that, circling back to one of the comments you made at the top of the show was, trying to find more ways to collaborate. And I think, it's great to be here talking with you all and hearing your expertise on this.
This is one of those ways, huh? All right. I want to thank Dr. Elliott Horner and Dr. Nick Nassikas, my co-host Cliff the Z-Man Zlotnick, our engineer Grayson Gone Fish and Fisher, our sponsors, and most importantly, our loyal audience. We appreciate all of you. Next week, we've got another great show. You got to check this out. We're going to go over the new S700 fire standard with Bran Lynch, co-chair John Pletcher, Mark Springer, and the Z-Man, and special guest host Rusty Amarante. Please come back and join us next Friday at noon for the next episode of IAQ Radio Plus.
For IAQ Radio, I'm Spike Reel saying thanks for listening.